On Thursday, every fourth Thursday morning, I get a telephone call, and I wet my wrists and put on some little bracelets, and I'm hooked into the New England Medical Center.
The computer at the hospital communicates with Nancy's pacemaker through the phone. The whole process takes less than 5 minutes.
That's it. Okay, thank you so much for helping me.
Thanks to the pacemaker, Nancy has resumed a more energetic life.
It's sort of a miracle, because if this had been another time, I would have been an invalid, or possibly I would not be here to tell this story. So it's a wonderful mechanism, this pacemaker. I love it.
3 years after bypass surgery, 41-year-old Ron Ricchino is obsessive about his heart health. He has made sweeping lifestyle changes that have helped to lower his cholesterol from 340 to a healthy 130. Ron starts each day with a handful of medications, including a statin, a class of drug that blocks cholesterol production in the body, mostly in the liver. The statin lowers his cholesterol by about 60 points. Ron has also taken up running.
I run about 2.5 miles, minimum 5 days a week. I try to do it every day.
Only about 22% of Americans get enough exercise to achieve heart health. 20 to 60 minutes of vigorous exercise 3 to 5 times a week makes the heart a more efficient pump. Exercise also helps lower cholesterol levels, blood pressure, and can help prevent heart rhythm disorders. For someone who has already had a heart attack like Ron, exercise can reduce the risk of future coronary incidents by as much as 90%. But Ron's lifestyle changes don't end here, because he knows his entire family is at risk. So far, Ron's 15-year-old son Greg has checked out fine. But 13-year-old Tracy has high cholesterol, just like her dad. So the Ricchino family has taken another step. They've changed their diet. And it all starts at the supermarket.
Do some shopping? Okay.
I'm taking a trip to the local market with Ron's wife, Carol, to see how she fights the cholesterol battle.
So all of this is out. Well, we do eat this one.
Carol's goal is to reduce the amount of fat in her family's diet.
When we read labels, if you look at the total number of calories and the calories from fat, the quick rule of thumb is that you don't want your calories from fat to be more than 30% of your diet.
With each item, Carol reads the label and does a quick calculation. If the fat calories are more than 1/3 of the total calories, then the fat content for her family is too high.
So now, do you do that arithmetic with every product you pick up? Absolutely. So this is the one we're going with. That's the one. This is soy. I use this instead of ground beef.
It's important for everyone to watch their total fat intake. But what increases cholesterol levels most are saturated fats.
The saturated fat goal is pretty intense. Ron's target for a day is 12 grams of saturated fat, which if you're a label reader, you'll see that could happen pretty quickly.
We don't do whole eggs, we do egg whites. The cheeses, the fat-free variety like the mozzarella.
Doctors recommend no more than 20 grams of saturated fat a day, but in the United States, each day we're consuming nearly 50 grams, and our arteries are becoming clogged. The Ricchino diet is high in grains, fruits, and vegetables. Carol has cut out most meats using low-fat or no-fat substitutes.
Everything that you would have normally, I just modify the ingredients. Everybody likes it. If I don't tell them that that's what it was made with, they never know the difference. No one suspects.
The Ricchino lasagna recipe has been specifically modified so there's almost no fat in it. Tracy uses fat-free soy instead of beef. She mixes the soy with saturated fat-free tomato sauce. And finally, she layers it with low-fat cottage cheese instead of ricotta. And non-fat Parmesan.
Here we go. Here's dinner.
Oh, wow. Looks great.
On a day-to-day basis, I mean, life is good. We want to just kind of keep it that way.
I'm at a point where any blockages that I might have or anything should be reducing because of being able to keep my cholesterol so low. It's not fun sometimes, but I'm alive, and you know, it's worth the sacrifice.
Each year, thousands of people with coronary artery disease join the ranks of the so-called no-option patient. They have blockages so severe that they cannot be treated by medications, angioplasty, or even bypass surgery. Hope for these patients lies in research aimed at stimulating the heart to grow new vessels. When our hearts experience angina, pain from lack of oxygen, the body naturally releases chemicals that stimulate new vessel growth.
Good.
But some people don't grow these vessels well or don't grow them at all. For these patients, a controversial procedure may help. It's called transmyocardial revascularization, or TMR. Here, a high-energy laser blasts holes or channels into the heart muscle. The laser burns a 1 millimeter wide channel through the left ventricle 20 to 40 times. It is not known exactly how TMR works, but the leading theory is that this minor damage to the heart triggers a response that stimulates new vessel growth.
A TMR, transmyocardial revascularization, is a method by which the surgeon tries to trick the heart into growing new blood vessels. The thinking is that that causes an inflammatory response. It causes the heart to release these mediators, these circulating compounds that cause new blood vessels to grow.
In clinical studies, patients gain, on average, a 20% improvement in blood flow and 72% experience significantly less pain. Dr. Michael Simons of Beth Israel Deaconess Medical Center is trying to stimulate the body to grow new vessels in a different way, with genetically engineered proteins. As we age, our bodies no longer produce the protein that stimulates blood vessel growth. Today, researchers can grow the protein in the laboratory and inject it directly into the heart to spur new blood vessel growth. These new vessels bypass the arterial blockages. So far, only a handful of studies have been done on humans, but the data looks encouraging. The yellow shows normal blood flow. The darker areas represent parts of the heart that were not getting adequate blood flow. Just 2 months after being injected, these parts of the heart are now receiving sufficient blood flow.
What you can see in yellow is a normal blood flow in the heart. The parts of the heart that don't get adequate flow here appear as sort of purple. 2 months later, but this part of the heart is now looking absolutely normal. So is this.
For now, gene therapy and TMR remain controversial therapies. But as blood vessel regeneration becomes better understood, scientists hope that the term no-option patient will become obsolete.
It's very sore right here.
Sore to touch?
Yeah.
What kind of a soreness is it?
More like